So I thought it was about time that I weighed in with my opinion about healthcare. Um, Basically, I think what healthcare should provide is access. I think the way to keep costs down is by providing everyone with free access to healthcare. All right. Now, what that means to me is that if a person has access to healthcare, they will get testing. They'll go for checkups. They'll get early testing. They'll be able to detect things that may be wrong with them before they show up as, critical symptoms. They get early treatment, which is in most cases far less invasive and far less costly. If you can prevent a symptom from developing, then you don't have to go in and have major surgery to remove damaged organs and crap like that. All right, the advances in medical technology are such that they can detect things that are wrong with you far before any symptoms develop. Okay, and early testing and treatment is absolutely vital if we want to keep the cost of healthcare down. The other thing is with accessibility to healthcare. If you're diagnosed with something, well, what you should do is you should seek some way of validating that conclusion. One of the biggest costs with healthcare is when people get misdiagnosed. They end up going through the system again and again and again. They go to the same doctor, say, "I'm still got the symptoms." Doctor say, "Well, let's try something else." Da da da. And, that's low quality healthcare when people get misdiagnosed. And this happened to me too. I don't know anyone it hasn't happened to, that they haven't misdiagnosed something. Getting second opinions, I think, is vital. People who rely on only one opinion are taking the risk that they've been misdiagnosed, all right? And these things just drive up the cost of healthcare. You're treating the wrong thing. Not only is it misapplied, but it's not treating the actual affliction, which is just getting worse while you're trying to treat this thing which is non-relevant. All right. So, to me, keeping the cost of healthcare down involves easy access for everyone. Okay. Now, what the insurance companies say, well, we can keep costs down only if we make the patient, responsible for some of the costs. That way, the customer will have this market mechanism, and the customer will seek more reasonably cost doctors. Well, I don't think that works at all, because there's two incentives there. There would be the incentive to keep costs down. There's also the incentive not to go at all. Okay. And the insurance companies don't make any distinction between the two. I think by far keeping accessibility free and open far outweighs any sort of savings that the insurance companies could claim by, putting some of the burden on the customer with co-pays or deductibles or any of that crap. All right, I think that's bullshit. I think that the insurance companies should bargain with and negotiate with the doctors that under an insurance plan that perhaps it may restrict the doctors you're allowed to see that are within that network. That insurance company has a right to approve of certain doctors it negotiates with over price. All right, but I think taking the customer out of that loop makes a lot of sense, because the customer is clueless. The customer doesn't know until they see a fair number of doctors what the hell is going on with them. All right, how are they supposed to know how much they're supposed to pay for something? All right, it's just ridiculous. I say take the customer out of the whole price structure loop. Have the insurance companies negotiate with the doctors and approve doctors to be within their networks or their plans. Okay, that makes far more sense than trying to push that burden onto the patient who is clueless. All right. In terms of private versus publicly owned, I think that the government has to get involved in some way, because at bare minimum, the private health insurance industry needs to be very tightly regulated so that they don't do things like create pre-existing conditions to deny coverage, or create these hoops that people have to jump through to get approval for claims and all this other crap. I think that it has to be regulated, very tightly regulated at a bare minimum. Now, having said that, I think that private health insurance does a lot of gouging. So I could see the possibility of setting up public co-ops. And I think that would be perfectly reasonable, that people just get a co-op together and they pay into the co-op. It doesn't have shareholders who need to be paid. It doesn't have a highfalutin board of directors that's incestuous across the whole industry. I think that having something that's a non-profit public co-op, I think something like that would be very attractive to patients. And I think it's well within the charter of the government to allow this sort of thing. In fact, I think disallowing it would be government intervention in favor of these private for-profit corporations. Right? My problem with the private health insurance industry is that even when regulated, that years down the road they're going to hire their guys to go in and figure out some way to deregulate it all over again. We'll end up in the mess we're in all over again. Okay, so the same thing happened with Wall Street. We put in all these regulations, but they get their guys in, they start speaking the mumbo jumbo to their lobbyists and to the legislatures, and they undo all these regulations, and we end up in the same mess we were in to begin with. All right. So I don't trust private insurance companies at all, because I think even when we regulate them, they're going to be working as hard as they can to undermine it. So I'm not convinced that they're trustworthy. So I wouldn't mind seeing them go completely. All right. So I think a public option, if they can't compete with a public option, there's no love lost as far as I'm concerned. So that's all I'm going to say for now. Thanks for watching. Bye.